Hi, I'm Katie, Elemental Health's AI guide. In this video, we review common challenging ketamine experiences and non-ordinary states work. These sessions can be deeply healing, meaningful, and transformative. But it's also important to understand that some experiences can feel emotionally intense, unfamiliar, or even frightening in the moment. This video is designed to help normalize some of the more challenging experiences patients may encounter, and explain how to work with and integrate them safely and constructively. One of the most common challenging experiences in ketamine work is dissociation. Dissociation is the feeling of temporary separation between the mind, body, emotions, or ordinary sense of reality. Patients may feel detached from their physical body, lose awareness of time, feel like they are floating, or experience the environment in unusual ways. Some people describe feeling far away, dreamlike, or disconnected from their usual identity. While this can feel unsettling at first, dissociation is actually one of the core therapeutic mechanisms of ketamine. It allows the brain to temporarily step outside of rigid thought patterns, emotional loops, trauma responses, and habitual ways of experiencing reality. In many cases, the healing begins precisely because the mind is allowed to loosen its grip on those familiar patterns. Another profound experience some patients encounter is ego dissolution. Ego dissolution refers to a temporary softening or loss of the normal sense of self. During this experience, patients may feel as though personal identity, boundaries, memories, or even the distinction between themselves and the world around them begins to dissolve. This can feel incredibly peaceful, spiritual, expansive, and connected for some individuals. For others, especially if they try to resist or control the experience, it can feel frightening or disorienting. Patients may think things like, "Am I disappearing? Will I come back? Am I dying?" These experiences can resemble what people often describe as near-death experiences or deep meditative states. A feeling of surrender, timelessness, transcendence, or separation from ordinary reality. Importantly, these experiences are temporary and occur within the context of a medically monitored and therapeutically supported environment. While they may feel psychologically intense, they are not physically dangerous when properly supervised. One of the most helpful things patients can understand is this: challenging does not mean harmful. In fact, many patients later describe their most difficult sessions as some of their most meaningful or transformative. Often, these experiences surface emotions, fears, grief, trauma, or existential questions that have been buried or avoided for years. The goal is not to fight the experience, but to learn how to work with it. One of the most important tools during challenging experiences is surrender. The more someone attempts to force control, resist sensations, or escape the experience, the more anxiety can intensify. Patients who are able to gently observe, breathe, soften, and allow the experience to unfold often move through difficult moments more smoothly. Grounding techniques can also help significantly. This may include focusing on the breath, listening to music, feeling a weighted blanket, holding a support person's hand, reminding yourself, "This is temporary. I am safe. I am supported." After the session, integration becomes critically important. Integration means making sense of the experience and translating insights into growth. This process may involve therapy or counseling, journaling, meditation, discussion with trusted supports, rest and reflection, allowing emotions to surface gradually without judgment. Sometimes patients feel emotionally raw or vulnerable after profound sessions. This is normal. The brain and nervous system are actively processing material that may have been held for years. Another important thing to understand is that no two sessions are the same. Having one difficult experience does not mean future sessions will feel that way. Often, the brain and body become more comfortable over time, and treatment can be adjusted through dose changes, pacing, preparation, or grounding strategies. Ultimately, this work is not about chasing only pleasant experiences. It's about creating space for healing, insight, and transformation. At Elemental Health, our goal is not only to keep you physically safe, but emotionally supported throughout the journey. Difficult experiences are a known and respected part of this work, and you do not have to navigate them alone. Healing is rarely linear, but with support and patience, Even the most challenging experiences can become meaningful steps toward resilience and recovery.